I'm Julian Drucker and you're watching a 5 News Tonight special. Prepare for the coronavirus to spread. The Prime Minister warns the outbreak is likely to get worse, but says there is a plan to tackle it.
If and when it starts to spread, as I'm afraid it looks likely that it will, we are in a position to take the steps that will be necessary.
We'll be speaking to GP Dr. Sarah Jarvis and Professor Paul Hunter, an expert in infectious diseases, about how frontline healthcare workers are preparing. Also on the programme, your coronavirus concerns. From a lack of information to stockpiling food, a 5 News exclusive poll reveals what you're worried about. And coronavirus in the workplace. We'll find out what your rights are if you're forced to stay away from the office. That's all coming up in our 5 News Tonight special, Coronavirus Crisis. Welcome to 5 News Tonight. The Prime Minister says the coronavirus is likely to spread in the UK and is urging people to do their bit by washing their hands properly. Today, 4 new cases of the virus were confirmed, bringing the total here to 40. And not all of them can be traced back overseas. Leading health officials are warning us to prepare for a widespread infection, but for now the advice remains business as usual. Our health correspondent Catherine Jones has the latest developments.
In a clear signal of the seriousness of the situation, today the Prime Minister chaired his first Cobra Emergency Committee meeting on the coronavirus.
Doing a great job. Taking the right action. The officers doing the right thing.
Ministers and medical experts arriving to finalise Britain's so-called battle plan.
Spread diseases, keep it in your handkerchief.
Afterwards, the PM said everyone can get on with their daily lives with confidence in the government's preparations.
As and when, if and when it starts to spread, as I'm afraid it looks likely that it will, we are in a position to take the steps that will be necessary will be reasonable, will be possible to contain the spread of the disease, and as far as we can, and also to protect the most vulnerable.
Yesterday, the UK had identified a total of 36 cases. Today, that figure rose to 40. So far, almost all, these yellow dots, have been people arriving from virus hotspots abroad, and that includes the 4 new cases today. But on the Surrey-West Sussex border and in Essex, these red dots show where people appear to have been infected in the UK. After an initial test in a local lab, suspect virus samples arrive at Public Health England's main testing centre in North London. Here they extract genetic material to determine if someone's infection is COVID-19. These instances of person-to-person transmission in the UK are a concern because up until this point, these tests have only been ordered when a patient has both symptoms and a clear connection to a foreign outbreak. Now, that may have to change. Public Health England is already doing random tests to try to get early warning of when the virus does start to spread more widely. And we must all begin to get used to the idea that there will come a time when our daily lives might need to change.
I'm sure we will be likely to ask people to go to school, go to work, but outside of those activities to spend less time doing social things that bring them into contact with other people. But all those things do take us away from life as normal, so we need to make sure that we've got that in proportion.
Their plan decided, ministers dispersed to start putting it into action this afternoon. The details it contains will be published tomorrow. Catherine Jones, 5 News.
Now, as the coronavirus spreads and increasing numbers of people are infected, the pressure on our health service will be significant. Well, joining me now is GP and Clinical Director of PatientAccess.com, Dr. Sarah Jarvis, Professor Paul Hunter, who's an expert in infectious diseases from the University of East Anglia, and, of course, our health correspondent, Catherine Jones. Dr. Sarah, first of all, we last saw you on Friday. The number of cases has gone up. Of course, people are going to get more concerned, aren't they?
People are going to get more concerned, but we do need to put this into perspective. At the moment, we've had 40 positive cases and about 12,000 people tested. So the vast majority of people who are being tested because they're at high risk have so far proved to be negative. It is more of a concern that we're beginning to see cases of people who don't have an obvious connection outside the UK. But again, we do need to put this into perspective. The vast majority of people who get coronavirus are going to recover from it. About 98 to 99% of people will recover, compared to, say, MERS, where 60% of people, 40% were dying with coronavirus and SARS, 10% of people were dying.
Paul, you said you're feeling less optimistic at the moment.
Oh, absolutely. I think what we're seeing elsewhere in Europe and indeed globally over the last week really has been quite saddening, because we've been for several days, in fact several weeks, we've been seeing a gradual decline in numbers in China, and then just as though it looked like we were able to get on top of it in China, it starts spreading elsewhere in the world, and there's big increases in South Korea, in Iran, in Italy, and then from Italy there seems to be cases cropping up all over Europe now. So it's concerning on a global scale, and then within the UK we're not only seeing cases that are being brought into this country, but we've now got 2 patients who have no obvious foreign connections, which is particularly concerning, and it does suggest that it's perhaps now spreading within the UK.
Kathy, there's advice out there, isn't there? But this NHS 111 tool, there's some bad news tonight, isn't
Well, they have launched a tool to allow you to kind of look for advice online and take you through some steps. Unfortunately, yes, it doesn't seem to be working at the moment, but they do say that it has helped 70,000 people since it launched last Wednesday. So I would give it some time. Obviously, there's going to be a great deal of interest today and a great deal of concern, which is perhaps why it's crashing this evening, understandably. I mean, more broadly,
I can say the tool is really good when you do.
Oh, good.
We are producing our own one on patient access, but it's actually very much along the same lines, because it's clear and it gives you very clear advice of when you need to self-isolate, how you self-isolate, and importantly, what happens if you're away from home when you get the news. How do you get home? Not by public transport, if possible, please.
I mean, when should people, either use that or make the phone call? I mean, at what point? Did they leave it a few days or?
I think if you've been to one of those at-risk areas, it's certainly worthwhile using the call. So, as we've already heard, that's large parts of northern Italy now, above that sort of line across. And then, of course, as well as those lockdown areas, as well as the other really high-risk areas, we've got China, Malaysia, Macau, Hong Kong, Thailand, Taiwan, Singapore. We've now added Vietnam, Cambodia, Myanmar into the mix. So if you come from any of those, it is worth your while using the tool. But basically, unless you're getting symptoms, if you've come from most of those areas, unless it is Iran or a lockdown area, one of those 11 towns in Italy, then unless you're getting symptoms and you've been in obvious contact with someone, you don't need to isolate yourself.
And an interesting warning today, Paul, from health chiefs in Japan to young people. They sort of said, you may not realise that you're giving it to older people because obviously you're stronger. I mean, no sort of message like that here, but a really interesting angle.
All the focus has been on the elderly and the people with prior illness, and that's because they get the most severe disease. But certainly, when you look at other infections, it is almost certain that a lot of the spread is being driven by younger people who move around a lot more than the elderly, and but don't actually necessarily get that severe an illness, and might actually just have fairly mild symptoms, which they probably would normally ignore.
And although that's good for them, unfortunately that does make it much more difficult to trace. I mean, I was told just this evening by Public Health England that the case in Surrey was picked up by their surveillance system, which is really...
That's much more worrying.
Well, it's worrying, but also exciting that we have the capacity. We're looking, basically 100 GP practices are just anyone who has flu symptoms, no connection to China or anywhere else. They're just testing them just in case. And this case has been brought up in this way. So I'm glad it's been found, but it does show that potentially transmission, potentially without symptoms or with mild symptoms, which may well be young people, may well be happening. I mean, what are your thoughts?
Well, it's definitely that if you do get symptoms, fever is a really prominent one, and that a sore throat and a runny nose are not big symptoms. So it tends to be fever, cough, and then later shortness of breath. But I don't think there's any question. The good news, as you so rightly say, is that not just young children, but pregnant women who tend to be very badly affected by flu do not appear to be suffering badly in this. So that's one group of the population we don't need to be too worried about. But I do think that maybe if you've got elderly, vulnerable relatives, within the next couple of weeks, it may well be a case of limiting your grandchildren's contacts with them, limiting having big family parties for their 80th or their 90th birthdays.
I was going to say, Kathy, I mean, we're at the Health Secretary saying we're at the contain stage at the moment. Next goes to delay. I don't know at what point that happens. And
well, we'll hear an awful lot tomorrow. I mean, this is going to be a big day tomorrow when we're going to hear this plan that the government has come up with. And yes, I think there'll be practical measures, particularly for the vulnerable, to give some more detailed advice to people who look after the elderly or who are in contact with them. And then there are going to be some more kind of further off in the future contingency measures, which I think could sound quite scary, especially if they're written up in a kind of, oh, here it comes type of way. I do hope that doesn't happen because, the government are really keen to stress, if we do a lot now, we may never get to that point. If we can push this peak of the epidemic into the future by these delaying measures, then, hopefully would never get to the kind of things that they are going to announce they are planning for tomorrow.
And just finally, do you think they'll step up the advice? We were talking before about ATMs, for example. Will there be more public health messages? Will that frighten people?
No, I think we do need sensible public health messages, but I wish in the first place people would really take more notice of the idea that they really do need to start coughing into a handkerchief in their hand or even into the crook of their arm and then throwing that tissue away and then using alcohol-based gels, not the normal antibacterial gels, but also really simple common or garden hand washing. If you do it often enough, we can make dramatic inroads into this.
Thank you so much. We'll see what happens tomorrow. Thank you very much indeed, everyone. Thanks. Now, clearly, it's a situation that is fast developing, and now an exclusive poll for 5 News has found that more of us are worried about the outbreak. 31% don't think we've had enough information about what to do if we suspect we're infected. We just had lots of advice there, of course. 68%, that's more than 2/3, believe coronavirus is more of a threat than SARS and Ebola. And 5%, that's 1 in 20, are stockpiling in the event of a major outbreak. As more cases develop, every aspect of our lives could be affected, from earning a living to going on holiday. Warren Nettleford has the latest on what we should be doing and what we shouldn't.
Microscope, it's tiny, but already the coronavirus is having a notable impact on our lives in the UK. Now, there are major questions about what this virus means for our way of life. The threat of the virus has led some firms to close their offices. Even some schools have been closed as a precaution. And so now workers, especially those in flexible employment, have raised questions as to what this could mean for their jobs.
I think in most cases there will be a way for employees who are concerned about coronavirus, whether they've got symptoms or they want to self-isolate or their children are self-isolating, for them to be able to take the time off. The question is whether or not they will be entitled to be paid for that time off, and if so, at what rate.
International travel is central to the world economy, but that provides more opportunities for the virus to spread. The Foreign Office are advising travellers to avoid areas affected by the coronavirus and to contact the NHS if they've been to areas hit by it. The British travel industry say staying informed is key.
There is a lot of worry about coronavirus, but I think we need to bear in mind that authorities around the world are taking appropriate action to restrict the virus from spreading. I think that should be a reassuring message that people can still travel. Just keep an eye on the Foreign Office advice. And if you want 100% protection financially, book a package holiday.
Medical experts say we're at a critical point. How the population reacts now could determine how much the virus spreads. The most simple things like washing your hands thoroughly for 20 seconds every time you enter a new building could make a huge difference.
Now, hand washing is really important to reduce the risk of infection. What we're doing here is rubbing the viruses away from our hands and down the sink. So we've got thumbs, we've got a bit of nails here, in between the fingers, over the top, and that's all it takes to be safe.
This evening, British Airways have announced that falling demand has led to them cancelling flights to the United States and Europe. The impact of the coronavirus continues to be felt. By how much more could depend on us all. Warren Nettleford, 5 News.
Well, it was mentioned at the beginning of Warren's report just there. What happens with your work if you think you might have the virus? We're going to talk about that a bit more now. I'm joined by Faye Law, a senior advisor at ACAS, which provides advice to employers and employees. Hi, Faye. First of all, this is just throwing up so many issues, isn't it,
Yep.
first of all?
Of course it is, yes.
I mean, what are the main concerns people are coming to you with?
We have had a lot of queries from staff wondering how they should contact their employers, and for employers wondering what best practice to put in place. And of course, it's always best practice to have clear guidelines and policies and communicate them well with staff on what to do in the event of illness or any serious disruption, now is obviously a very good time to revisit and recommunicate that.
And internally, companies might be sort of suggesting to people they work from home, not officially, but
yes.
For some people, they can't work from home. They have to go in, don't they?
And this will be familiar to a lot of organisations at the moment in terms of business continuity. A lot of organisations will have recently experienced that in terms of severe weather disruption. And so people will, in a lot of workplaces, have plans in place. The key is to keep communicating from the management side and the staff side, to be in constant communication with each other, for the employers to be looking daily at the latest guidance and advice from government in terms of managing risks and health, and for employees to make sure they're aware of the communication lines and reporting lines that they have should the unexpected happen.
And for people in the service industries, particularly people on 0 hours contracts, they could potentially suffer really bad hardship, couldn't they, in the next few weeks?
It is potentially. What we're asking employers to consider is, firstly, can people continue to work? If they feel or staff feel that there is a particular risk to coming into work, we're asking employers to be sensitive to that and listen to the concerns of their staff. If the staff have concerns that they are at particular risk as individuals because of an underlying health concern, we'd ask them to work with their employer together to see what alternative arrangements could be made. That could be possibly remote working, flexible working, working from home, or another option is for the business to see if it can accommodate people working their hours at a different time when the highest risk period has passed.
And a concern, children being self-isolated in cases, those parents would then have to stay at home. I mean, that's another issue as well, isn't
Absolutely. Obviously, if children are sent home from school, that's going to be the parents' main priority and their greatest concern. Unfortunately, employment law does foresee these short-term scenarios, and there is a right for time off from work for dependents in order to make arrangements. We just remind employees to keep in good communication with their employer should that arise.
And the absenteeism is obviously going to rise exponentially, isn't it?
I'm not sure that anything is obvious at this point, but the key is to keep aware of the latest developments and make sure that everybody has clear lines of communication, that staff have a way to keep in touch with the workplace, and that the workplace has the correct and up-to-date contact details for their staff.
Good advice. Thank you very much indeed, Faye Law. Thanks for that. Thank you. Now, as plans are being made here, the virus is taking its toll globally, claiming the lives of more than 3,000 people. All countries in Western Europe now have confirmed cases. And the EU has raised the risk level of the disease from moderate to high. Mark McQuillan reports.
In France today, another example of the impact the coronavirus is having. The world's most visited museum, the Louvre, closed again amid fears over the infection spread. There have been more than 100 confirmed cases in the country so far. That figure is much higher in Italy, which has seen the biggest outbreak in Europe. A significant spike in cases over the weekend saw the total go beyond 1,500. It led to the closure of this French church in Rome, a notice confirming the news after a priest was infected with the virus. In Germany, there have been 150 cases, and whilst Chancellor Angela Merkel isn't one of them, her interior minister wasn't taking any chances with a handshake. A light-hearted moment, but the situation across Europe is becoming increasingly serious.
ECDC has announced today that the risk level has risen from moderate to high for people in the European Union. In other words, the virus continues to spread.
The virus is spreading fear among the world's financial markets too. Earlier, one group of forecasters cut its global growth prediction from 2.9% to 2.4%, warning that figure could fall further if the outbreak lasts longer. Back in the country where it originated, work continues to try and find a cure for the virus. Chinese President Xi Jinping met with researchers at a medical facility earlier, while analysis is done and experiments carried out to try and contain the spread of an infection which shows no signs of slowing down. Mark McQuillan, 5 News.